Welcome, everybody, to this new episode of CCIR's Student Spotlight. With me today is Jean O. Jean is currently a 11th grader at St. Peter's Preparatory School in Jersey City, the United States. For his time at CCIR, he took the Future Scholar course on nanomaterials applications in industry, sustainability, and healthcare with Dr. Marco Alban Pacha from the University of Cambridge. For his final project, Jean is currently working on a project centered around the applications of nanotechnology and nanomaterials in drug delivery. We're going to learn all about Jean and his experience here at CCIR today, but the first thing to say is, Jean, welcome to the show.
Thank you for having me.
So, Jean, the first question I want to quickly ask you about is what first brought you to, let's say, CCIR, to thinking about doing a research program? And in particular, what was it that drew you to this subject of nanotechnology and nanomaterials?
Yeah, so my high school is not the most science oriented, and so I just wanted to look for an opportunity to really explore that passion outside of high school and delve into a topic that isn't really explored in a typical curriculum. So I wanted to really try that possibility with CCIR. Um, and when I was looking for courses that I might want to participate in, learn about, I really wanted to learn about something that would be very applicable in not only like right now, but in the future. And I thought that nanotechnology and drug delivery had a perfect mix of um, current relevance and like increasing importance in the future in pharmaceuticals and like society at large.
So let me just pursue that a little bit further. So I'm curious, what was it that so before you came to CCIR, first question, before you came to CCIR, did you sort of already know about nanotechnology, or was it were you sort of captivated by, let's say, the title or something like that?
Um, so when I first chose nanotechnology, I didn't really have much idea about how it actually worked. All I really knew about it was that it was very small, but as I really delved into my project and attended the sessions, learned about it, I really got to know that the properties they derive a lot of it derives from the size itself and how that can enhance other properties such as like solubility and things like that.
So maybe for those of us who are less knowledgeable than you, which is most of us, about nanotechnology, if you can just give us a quick sort of overview of what it is, what nanotechnology is, and maybe some of the exciting sort of prospects of this emerging technology.
Mhm. So nanotechnology is the use of structures that are anywhere from 1 to 100 nanometers in size. Um, it has properties such as enhanced solubility, which basically means it can dissolve in water better. And its small size allows for different physical, chemical, mechanical properties that typical substances on like the macro scale can't really exhibit. And this can be exploited by scientists in a range of fields, not only drug delivery, but also in energy and electronics. So as you may or may not know, so electronics are constantly getting smaller and smaller, and we're continually hacking more and more processors on smaller chips to improve efficiency, just pack more computing power in a chip. So nanotechnology is becoming more and more relevant there. It also has applications in material science, as I said, pharmaceuticals, um, and in other biomedical devices.
Yeah, that's super, super interesting. So maybe you can tell us a little bit about sort of the first half of the program. So as you know, in the Future Scholar program, the first half of the program is really going to sort of highlight some of the major developments in the field that you're working on. So this is sort of much more teaching focused. Was there any one sort of lecture or discussion section with your TA that really sort of stood out to you early on as like, wow, this is really, really cool?
Mhm. So when it came to the first half of the program, I was particularly fascinated by how nanotechnology could be used in solar panels. So we discussed how it could be used to really optimize the capture of energy by designing certain structures to more efficiently capture the energy of light. And I just found that like especially interesting um like as because we are progressing towards um a world with cleaner energy, and like I just found that like very relevant, very interesting. Yeah.
So let's sort of move now to thinking a little bit to talking a little bit about how you made the eventual transition from sort of imbibing all this knowledge and consuming all this knowledge and developing your understanding of the field. Um, and as you sort of began transitioning towards focusing on your own project, which ended up being centered around drug delivery, can you tell me a little bit about this process as you transitioned from, let's say, the learning component to more of the research component? Tell me sort of how you began thinking about which topics you wanted to work on.
Yeah, so similar to when I was choosing which program I wanted to participate in, I wanted to choose something that was very much relevant in today's world. And I decided to go into drug delivery just because of how applicable it was in the field. And the transition from the classes to the actual project. So we began learning more about what actually goes into um, building a project. So starting from what question you want to explore, and then from there, determining a structure. So finding papers, evaluating their reliability, and like synthesizing new conclusions from which other people can learn and like better advance their own knowledge of the field.
Yeah, fantastic. So tell me a little bit about um, sort of working with Marco through all of this in particular, because Marco is a fantastic, fantastic faculty member that we have. Tell me a little bit about the ways in which you and your faculty work together in orienting you towards sort of your final project.
Mhm. So Marco and the TA Luke were very much helpful to shaping the research process. They really showed us the ropes when it came to like starting off from the project and really designing our research paper to adhere to the typical norms. And they really helped us with the writing process, determining what scientific terminology is and how to really explain the structure, the topic of what we're talking about. And yeah, they just provided a very, very major role in shaping that.
So I think now it's a good time to actually start talking a little bit about your specific project. So maybe you can give us a quick overview of what you're currently working on in terms of nanotechnology and drug delivery.
Yeah. Um, so many of today's pharmaceuticals are plagued by problems such as low solubility, low specificity, which means they don't accumulate solely where you want them to. They are dispersed throughout the body. And this in turn can result in dosages that are higher than what you actually need. It can result in side effects that can be avoided. Um, and nanoparticles can help to alleviate this problem by accumulating more in the actual site that you're targeting and by really maximizing their cellular uptake, which means um, the amount that the cells of the body absorb them and um, are impacted by their effects.
So I imagine one example potentially for the more traditional form of medicine might be something like chemotherapy. Would that be sort of one that's a little bit less targeted, a little bit requires a higher doses, have certain kinds of side effect?
Yeah. So chemotherapy is the use of drugs to combat cancer. And so what often happens is that the drug, as I said, it disperses throughout the body. And when it does that, it doesn't necessarily exercise its impact only on where you want it to. So, for example, if you're targeting maybe a lung cancer and you're using drugs to target the lungs, that drug will be absorbed by cells throughout the body, and you don't want that because the other cells are fine, but the lung cells are what you want to really target. So um, smart drug delivery is really intended to improve that aspect of pharmaceuticals.
So now I'm curious. That all sounds makes sense to me, but how does it work? So we're looking to nanotechnology to create a more sort of targeted solution to certain kinds of diseases, such that we can actually target the areas that actually are currently breaking down. So what is it that nanotechnology can do here, for instance, to specifically, let's say, target the lungs? What is sort of smart delivery and how does it work?
Yeah, so smart drug delivery is basically the use of whether it is endogenous, which means internal stimuli, such as the pH of blood or the presence of certain enzymes in the blood, and exogenous stimuli, which are external, which can be controlled by technologies. So examples may include like light, heat, ultrasound, magnetism, and a number of others.
Mm.
And you can use that to selectively turn on or and cause drug release at the site you want it to. Um, Nanoparticles also have improved physical and chemical properties, such as their size. So, given how small they are, you have more particles for a given um, area of particles, and basically that means a higher surface area is exposed to the blood, which improves solubility. Um, a lot of cancer drugs actually are plagued by low solubility, which can get in the way of R&D and also applicability in the body. And these smart properties can be achieved by really tuning the materials that go into a nanocarrier, such as like lipids or polymers. You can also outfit them with um, these really responsive materials and allow for this selective turning on or off of drug delivery.
So I'm really interested by this because it does sound like it is a pretty revolutionary technology. My first question here, I have quite a few questions right now, but my first question is sort of how far along in the line of development are we here with the development of these kinds of treatments? Will we be expecting these treatments within the next 5 years, 20 years? What's sort of the state of the art of nanotechnology as applied to drug delivery?
So I believe there are already some nanoparticle formulations on the market, but I can't exactly provide like a time frame for when they're gonna really become mainstream because some problems that scientists have to address include their toxicity, their accumulation in the environment. So they're still exploring those problems. But um,
So,
sorry.
no, no, that's perfect. So there seems to be still quite a few challenges that faces this technology. I'm curious, sort of in your own investigation, what were you sort of specifically focusing on? Were there specific challenges that you were interested in, specific sort of upshots of this technology that you were particularly sort of excited about and working on?
Mhm. I was really excited about the special properties that nanoparticles exhibit, and I really wanted to explore that through the course, see how chemically, biologically those properties can be taken advantage of. And um, sorry, could you repeat the question one more time?
So basically, what were sort of the things that you were excited about, specific challenges that you might have been interested in with respect that you're sort of working on in your research right now?
Yeah. So I was really interested in solving or trying to solve the challenges that plague modern medicine by circumventing some of those negative properties and trying to um, really enhance the benefits that current pharmaceuticals can further exhibit. Um, so these include, like, as I've said, like low solubility, low specificity, and I really wanted to see the technicalities of how the small size can be used to really enhance that.
Um, that's super interesting. One other question I have right now is because you were a part of the Future Scholar course, you were also working with peers. And this meant that your peers were also doing sort of different projects in the same space, but with different focuses. So tell me a little bit what that was like working with peers who, you know, are the same age as you, but super interested in nanotechnology and engineering and physics and chemistry and all of these things. What was it like working with them? And how did the peer-to-peer aspect of your experience show up for you in your course?
So the peer-to-peer aspect was like a core part of the second half of the course when we were really beginning to write our papers, explore our topics. So um, especially so we would look at each other's papers, look at each other's topics. We would analyze our writing, just provide feedback, try to better capture our message, what we're trying to say. Um, we also learned like a lot about each other's projects. So I know one of my peers is exploring biomimetic materials, and as me and my other peer were working through her paper, just looking at it, maybe providing possible revisions. Like we really got to know some of the um, important aspects of her work, and like it was fascinating to see how nanotechnology could be used in other ways and to really read about it through the lens of another student.
Yeah, biomimetics is so cool. I would love to have a little conversation about that as well. But we want to keep it focused here today on sort of you and your work, and spotlighting sort of what you have done here. Um, I feel like as we are coming towards sort of a conclusion, I usually like to ask a question that I ask all the students on these kinds of interviews. And the question is basically this. Um, you just came through a pretty long program. It's 13 weeks. It's not the easiest thing in the world, as you know. Doing a research paper takes a lot of time. The courses are hard. The material is pretty intensive. So all of this can show up as pretty daunting for students. It can be a little bit of a challenge, and people might be a little scared of doing research if they've never done it before in the past. So, as someone who has walked down this path, as someone who has sort of gone through the whole process of CCIR, what would you say to a student who is sort of considering embarking on research, but maybe a little bit nervous and afraid to sort of dive straight in? What sorts of advice would you give them now that you've come through the other side?
Mhm. So I would say choose a topic that you're very much interested in, and choose a topic early. So one of the problems that I may have faced in my project is maybe bouncing around different topics and not really settling on what I wanted to do. So I would say really choose one topic, be ambitious, but be realistic, and really think about how you want to explore that through your paper, whether that's through original research like simulations, things like that, or by doing a literature review where you comb through a number of different papers and make new conclusions. Um, and I would say just always put in the work, be determined, and make small steps along the way just to divide the bigger task into small steps and make it easier for yourself.
That's incredibly practical and wise advice, I think, coming from you, Eugene. That's really excellent. Um, so the upshot seems to be something like take charge, plan your experience, and make sure that you're sort of making it manageable for yourself. I think that's really, really excellent advice, Gene. It was super, super interesting today to learn a little bit about nanotechnology, which I really didn't know anything about, but also learning a little bit about your experience and your work here at CCIR. It sounds like you're gonna keep doing really exciting things. It sounds like you have a genuine interest and passion for science and for all of this. And so, with all of that, I wanted to say it has been an absolute pleasure chatting with you today. And best of luck in all your future scientific investigations.
Thank you for having me. Thank you.